Good evening. My name is Erin Smith, and I'm a licensed independent clinical social worker and the clinical director at Lydia Place. Many people in our community are familiar with the incredible work Lydia Place does to help families with housing, but often don't realize that we also have an awesome and thriving clinical mental health program too. Now, more than ever, we all can appreciate the impact and importance that mental wellness has on every single area of our lives. From our earliest days of life and throughout our development, our mental health is woven through every aspect of our being. Our physical, emotional, and mental well-being is interconnected, and when one of those is not doing well, our life gets out of balance. But when we feel whole and strong mentally, we are in a position to live our best lives, to overcome what needs to be overcome, and to move forward with sustained independence. This is true for all of us here tonight, as well as the Lydia Place families we serve. Unfortunately, access to quality and affordable mental health services are not available to many that need it most. To work to address this challenge, the Lydia Place mental health program started from what seemed like an impossible vision to become a reality in 2014. With feedback from our frontline staff members, we started trying out a few different ideas on how to ensure that the work to house our families wasn't threatened by access to mental health services. Over the next 3 years, we worked behind the scenes on developing our own clinical program, and in 2017, Lydia Place officially started seeing clients with a very part-time clinical director and 2 master's level interns who were all able to provide critical and sometimes life-saving therapy to a limited number of clients. At that time, there were a lot of unknowns with the program, but we persevered, knowing that we wanted to be able to provide the mental health services that we all knew our families needed, but it just simply wasn't available. And you, our community, continued to help make our vision possible. Today, Lydia Place's mental health program has expanded significantly to include a clinical director, 2 full-time licensed clinicians, and a number of master's level clinicians who are all able to provide high-quality, flexible, mobile mental health services to individuals and families in our Lydia Place programs and beyond. In 2019, we provided more than 650 individual therapy sessions to 83 different people. While the primary service in our program is ongoing individual therapy in client homes, we also provide crisis intervention services, facilitate groups and workshops for clients, and our team provides education, training, and clinical consultation to Lydia Place and other partner agencies in the community. Our next big expansion came in 2020 when we started providing individual sessions to children, leaning into our mission to improve the lives of our neighbors today, but also for future generations to come. We know that mental health is stigmatized in our society, and this stigma causes people not to seek out support when necessary for fear of internal and external judgment. To help break that stigma, we want to recognize and celebrate May as Mental Health Awareness Month and talk about the fact that this month in particular, so many of us are feeling overwhelmed, balancing work and families, and dealing with anxiety about the future, bouts of depression, lack of motivation, exhaustion, trouble sleeping, grief, and loss due to the COVID-19 pandemic, and times are challenging. So know that you are not alone in how you're feeling, that it's okay to feel what you're feeling, and together we're making a difference in breaking that stigma just by connecting here tonight. If you can do more to help our work continue, we thank you.